In this video, I'm going to be talking about pigmentation laser treatment. This video will include information on the treatment of sunspots, freckles, and birthmarks. So how does laser treat pigmentation? Pigmentation is due to a concentration of melanin or skin pigment in a particular area of the skin. Now, this can be caused from a number of reasons. The most common in Australia is the sun. However, pigmentation can also be congenital, such as a birthmark, or hormonal, such as in melasma. The lasers which we use to treat these problems include the ruby laser, the rev light or med light laser, and the Gemini laser. And these lasers basically are attracted to pigment in the skin. Now, areas which have more pigment in the skin, for example, a sunspot or freckle, will pick up this laser energy at a greater level than that of normal skin, which is usually fairer than the freckle. In the ideal situation, you have pigmentation which is very dark that you want to treat, and the skin is very fair. However, you don't always have the ideal situation, and sometimes pigmentation occurs on olive or darker skin types. And in these situations, we have alternate strategies, which I'll discuss. In essence, these lasers are specifically targeted to the pigmentation problem and leave normal skin relatively intact or alone. The difference between laser treatment for pigmentation and, say, a treatment like liquid nitrogen for pigmentation is that laser treatment is very specific. Liquid nitrogen basically goes in and destroys any tissue lying in front of it. Laser only picks up the pigmentation from the skin, and it doesn't pick up normal skin which is paler. So what should you expect for your first consultation? The doctor will take you through your medical history and see if there's any reasons why you can't have the treatment at this time. For example, if you're on particular medication like Roaccutane, which precludes you from having laser treatment. Your doctor will also perform an examination, and this may involve looking at your skin under a Woods lamp, which is a purple coloured light or black coloured light like you see at nightclubs, and this can determine the depth of the pigmentation or the type of pigmentation it is. You also have an assessment of your skin type. Now, this may involve asking you some questions as to how easily you tan, or what's your natural hair colour and what's your natural eye colour. The darker your skin, the more difficult it is to treat your pigmentation with laser. And there will be a point where the pigmentation in your normal skin is too dark to actually have laser treatment. In other words, the laser won't be able to differentiate between your freckle or sunspot and your normal skin. So what should you expect during your treatment? If you're a fair-skinned person with sunspots, for example, it may be a simple matter of just going ahead with the laser treatment and not requiring any particular skin preparation. For those of you who have olive skins or darker skins, and in particular Asian skins, you may require a degree of preparation before undergoing laser treatment. This is to help reduce the rate of complication or problems, as darker skins or olive skins will tend to pick up the laser energy more readily than fairer skins. Often your doctor in these situations will advise that you go on a lightening serum like Kligman's lotion for a period of 1 to 2 months prior to your laser treatment. Also, for olive or darker skin types, a test batch may be indicated to see what the effect of the laser is prior to treating the whole area. A reduction in the laser settings may also be required in those with olive or darker skin types. And post-treatment care may involve the application of a topical steroid to help reduce inflammation after treatment. And this will help reduce the chance of post-inflammatory hyperpigmentation, which is darkening of the skin after laser treatment. The laser treatment in this case can be a little bit uncomfortable. It often feels like a hot, prickly sensation. The face can be treated in its entirety, as in you treat every part of the face, and you might do this in someone with widespread freckles, or you can treat spots, for example, in those who have just a couple of sunspots here or there. Numbing cream can also be applied prior to treatment, especially if you're having a large area treated, and this will help reduce any discomfort associated with the procedure. Cooling is also a very important part of the procedure. And by this I mean cooling the top layers of the skin with either a Zimmer cooler, which is a machine which blows cold air across the top of the skin, or through inbuilt cooling in the handpiece. But it helps to reduce any discomfort as well as reduces the side effects from treatment. After treatment, there's usually a degree of redness to the treated areas, as well as a degree of swelling, which will be proportionate to the intensity of the treatment. Depending on the laser used, the pigmentation may appear immediately whitened, and usually this lasts for 20 minutes. And after that, the pigmentation appears darker and remains this way for the next week until it scabs off. Other than feeling a little bit sunburned in the area treated, there is no real pain or discomfort after the treatment. Over the next week, you expect all the spots to darken and scab up and fall off after about 7 to 10 days. During this time, it's important to look after your skin, and it's important to put some cream on it, like bepanthen cream, which is actually nappy rash cream, or some other rich moisturizer. It's important to stay out of the sun and wear sunscreen as well for at least 2 weeks. As for all laser treatments, there are risk and benefit to each treatment. We'll be able to help you assess your potential risk for any complications prior to having your procedure. Firstly, it's possible to get a patchy result if the laser hasn't covered all the areas to be treated. And in these cases, we need to actually retreat and go over the area once again to help even out the treatment. Hyperpigmentation, or loss of pigment to the point where an area of skin becomes lighter than the normal surrounding skin, is a possible complication of laser treatment. In most cases, it returns after about a month, but can also take about a year to return. In severe cases, this may be a permanent problem. Hyperpigmentation, or increased pigmentation in the treatment area, is also another complication. This is a very annoying complication which can last for 6 to 12 months and requires the use of lightening serums to help reduce its presence. It often occurs in olive or darker skin types, so we have to take particular care in treatment of these patients. Scarring is an extremely rare complication and something we never see at this clinic with pigmentation treatments. Finally, infection with either a bacteria or the cold sore virus, Herpes Simplex, is another possibility after laser treatment. Again, this is very unusual, and if this occurs, we usually treat it as soon as possible and there's no consequence on the skin. So in summary, pigmentation can be treated effectively with laser, and this can help to improve your skin tone. It can help reduce your need to wear makeup and brighten the skin up.